Yeah, this MAHA moms thing's turning into a big deal. The Health and Human Services Secretary, Robert F. Kennedy Jr., taking aim at what he says are unhealthy food additives, and he's made these appearances alongside social media influencers. One in particular known as the food babe. And Kennedy's been pushing his agenda. He calls it Make America Healthy Again. So that's where you get the MAHA from, and raising the profile of this group of women who they now call the MAHA moms. They're calling for, healthier food, and they're challenging the medical establishment, which is what makes it also kind of politically interesting. One of them joins us now. Her name is Emily Stembridge, and she's a MAHA mom from Utah, right? So thank you, Emily, for coming on. So you got, I think you have 3 children, is that right? How'd you get kind of, I was going to say caught up. How'd you get involved in all of this and become a MAHA mom, so to speak?
I don't consider myself caught up in it necessarily.
Right.
This is definitely something that has been important to me most of my life, actually. I definitely grew up in a very health conscious family that was encouraging of kind of questioning the norm and thinking outside the box. And it was way before it was cool or trendy. So this has been the majority of my life, and it's just exciting to see it actually gain momentum. And
why do you think it has so much? Because, Kennedy himself is, to some people, a polarizing figure. They look at his controversial positions and things like vaccines come up. And then on these issues, some of them are different. They say, well, no. It's, don't paint with a broad brush, because there's other issues where it's not as controversial, but he's still challenging the establishment. So how do you think it turned into this movement, is what we're seeing, especially with moms?
I think that it already existed. I mean, if you're a parent, if you're a mother, you are constantly working every single day at trying to create the best environment and the best health for your children, right? I mean, this is something that, again, I think we've already been working at, forever, but, so many moms have been doing this silently in the background with no one to be a speaker for them, a voice for them. And now it's finally gaining traction, and someone at the top who's willing to talk about it, right?
Right. How closely associated is it, or is it not associated at all, with what people said would be like an anti-vax movement? Are the two related to you? I mean, like, for example, we have the measles cases now topping 1,000, which hasn't happened very often, a couple times in the last 30 years. So some people say, well, we get it. We want to get chemicals out of food. We want to do all these kind of things. But these same type of people are encouraging us not to get vaccinations. Is that an unfair criticism? How do you look at that?
I do think it's interesting that people kind of automatically assume that if you're MAHA, you're anti-vax or anti-this or that. I don't think that is all encompassing. I think that, yes, both of those things can exist, right? Within, I guess, those who associate themselves with MAHA. But ultimately, I think it's that we all have this goal of wanting to be as healthy as possible and get toxins out and address, again, look at these rates that we're talking about when it comes to autism, obesity, diabetes, cancers amongst children, among some of our younger groups. Like, what is causing that? Why is it? And so, no, I don't think it necessarily means that all of people who are in MAHA are anti-vax.
Right.
It's definitely not my experience. But does it include some of them? Absolutely. And do we all have a common goal? 100%.
So what's the common goal? How would you articulate it? What's the big picture goal?
I think, look at America, right? Look at where we've come. We know that we are dealing with insane rates of chronic disease, higher cancer, higher diabetes, obesity, mental health crisis. And again, these numbers are dropping into our younger and younger generations. And that's extremely concerning. Autism, as they've mentioned, so many things. And ultimately, I think the goal is we need to address it. We need to admit it, right? These things are happening, and why, especially when our nation spends the most of any nation and has the worst health outcomes. What are we doing? And we need to go back and evaluate what we can do better, because clearly what we're doing is not working, and we've got to make changes.
Good discussion on all of this. Go ahead. I'm sorry. I didn't mean to cut you off. That was the last point that you just said at the end?
I just wanted to say we've got to make a root cause approach. We've got to look at why and then address that.
Okay. Thanks for coming on, by the way. Happy Mother's Day. Thank you for coming on with us tonight.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.